Okay, everybody, welcome. We are going live, and here we are for the Diastasis Project. My name is Antony Lo, the founder of the Diastasis Project, where we seek to give you the highest quality information for a donation only. So please support the project. There's links in the description. You can use a QR code to donate. And if you want to register for the Diastasis discussions, you can do that too. So thanks very much for your support. Today, we are going to do overview of how diastasis and abdominal wall recovery will generally differ after cesarean birth compared to vaginal birth. So it's a great question. Thank you very much for asking the question. It's also not an easy question to answer because different people will have different things happen to them. So that's the difficulty there. You know, a cesarean section, you go through many, many different layers. You get to the uterus, you open up, baby comes out, and then you sew on the way out. Now, from what I understand, and from what I've been told, there's a minimum of 5 layers, 4 or 5 layers that need to be done. Most do around 5 or 6. The obstetricians that I've spoken to, they tend to say 2 layers inside the uterus. Then you've got the peritoneum, that's the 3rd layer. Then you do the anterior rectus sheath, and so that's the 4th layer. And then you've got the subcutaneous fat and then the skin on top. So that's 6 layers. You can do less, but I think the results tend to get a little bit messy. Now, if you do have a diastasis with a cesarean section, it's a diastasis anyway. So I don't think that it differs too much. Also, the amount of separation that is generated by a cesarean section, which is usually a horizontal incision just above the pubic symphysis through the skin and subcutaneous fat. They then just poke a hole through the linea alba and use a blunt dissection. In other words, they just use their finger and they pull up to create some space. So there's actually no cutting of the muscles during a cesarean section in most cases, okay? So there's no cutting of the rectus abdominis. Now the uterus is a muscle, so they do have to cut into that. That's a different thing. So from there, the sewing up occurs. Now, if you have a diastasis above the belly button or at the belly button, this isn't really affected by the cesarean section. If you had a diastasis below the belly button, they're going to join, usually they're going to join the 2 muscles back together again. But the cesarean section that I've watched, the skin is really loose. The muscles are really loose because your uterus now does not have a baby in it and it's adapted. So even if you sew it up, it's not like it's going to be a tummy tuck and everything's going to be tight again. It doesn't work like that. So whether you have a vaginal birth or a cesarean section, these changes occur. And then from there, the recovery is usually an open surgery, abdominal surgery recovery for the cesarean section. So it's going to take some weeks to recover. There's a scar to heal as well. Usually a vaginal birth, you don't have to deal with that. Of course, there are other complications that can occur, but all things being equal, a diastasis via a cesarean section birth is maybe just a little bit delayed in terms of recovery compared to the timeline for somebody who's had a vaginal birth. Now, I keep using this usually and uncertainty words all the time because there are some people who have a cesarean section who recover very, very quickly. They're back to doing things relatively normally after 2 or 3 weeks, but this is by far the minority. Like, this is not most people, but it does happen. Then there are people who take a long time to recover. And there are people who take a long time to recover after a vaginal delivery. And there are people who feel like they're back to doing what they were doing yesterday, the day of or the day after a vaginal delivery. There's no way to predict it. I've seen the same person recover very, very differently after the same mode of delivery. There is no predictive ability there. So in terms of what I'm looking for if someone's had a cesarean section is what is the scar like? Not in terms of, oh no, is it healing? Is it binding down? What stage of healing are we at? Is it still adapting? Is there still tissue laydown? I don't want to go too hard too soon on an incision because it can cause it to stretch. It is just generally weaker. It needs to heal. That's why you have stitches. Things that I look out for are things like stitch abscesses, where there's a little infection where there's a knot in the stitch. Sometimes a stitch doesn't dissolve away fully, and so it just keeps a little bit of inflammation going there. These are all medical concerns. If I see anything that looks red, or if it's reported to me, I always ask people to go see their doctor or their midwife about it because that is outside my realm. However, I have seen a lot of these. Another thing that I like to keep an eye on is how people feel about the cesarean section. So one thing that can occur is that it can be quite traumatic. So people have a range of different reasons why they have a cesarean section, and being sensitive to that can also influence the recovery from the cesarean section. Now, of course, the same thing can happen during a vaginal delivery, so I'm keeping an eye on those things as well, sensitive to the needs of the person in front of me, where they're at, how much rest they're having, a holistic approach. So in terms of how a diastasis or abdominal wall recovery might go, generally speaking, a vaginal delivery tends to be just a little bit faster, but then it also depends on when people come and see me. Do I think that it makes a difference in terms of if you should have a cesarean to manage a diastasis better or not? No. Basically, no. I don't think it comes into that. I think there are other reasons why people should consider a cesarean section over a vaginal delivery, and diastasis is not one of those that comes into my mind. There are many, many other reasons that are far more important as to why somebody might choose an elective cesarean section over a vaginal delivery. The state of their diastasis is not one of those reasons for me. Simply put, the uterus does a lot of the squeezing. So if you want to have a vaginal delivery and you have a diastasis, I don't believe that your diastasis makes too much of a difference on your ability to vaginally birth a baby. There's going to be far, far more important things going on there. And I don't think having a cesarean section and the way that they stitch you up is going to accelerate any healing from a diastasis either, because all of your tissues are stretched. They still have to adapt to you being upright and putting those stresses on the abdominal wall. So I hope that gives you a bit of an idea of where I'm at with the difference between a cesarean section delivery and a vaginal delivery and how diastasis is managed. I think it's a much more holistic approach in terms of caring for the person themselves as opposed to a particular diastasis specific reason. So the same rules apply, post-op recovery, sensible wound management, keeping an eye on things, understanding, of course, that as a physiotherapist and as a fitness trainer or coach, if you're not a nurse or a doctor, then probably not in our realm of scope of practice and referral on. Thank you very much. I do want to highlight to you that there are ways that you can support the Diastasis Project. So please subscribe to our YouTube channel, the Diastasis Project. I need to get at least 1,000 subscribers to go live on YouTube. Please join the Facebook group, which is where some of you will be watching this right now. Please join the Instagram page, the Diastasis Project. If you want to see the Diastasis Project and take part in that, please go to diastasis.info. The free webinar series that we have, which is Diastasis Discussions, please register for that. There's the link in the description. If you'd like to donate to the project, it's via PayPal. You can donate regularly or you can donate in a once-off donation. All of the donations will go towards supporting the Diastasis Project. And you can also support us by buying a course that supports the project. So the Lisa Ryan consult course with me, It's where the consult that I did with Lisa, it's a 2-hour-long consult, and Lisa and I watch the consult and give like our commentary 2 years later, discussing what we were thinking and how we were feeling at the time. It's really great. It's got reflection questions on it as well. And the Diastasis Reframed course, where there's a bunch of great people on the course, and it's a very interactive course, not just because you're watching it, but because of the reflection questions. So it's cut up into small segments, and there's reflection questions to guide your learning. If you want to support us, that's a great way to do it. Thank you very much for watching, and I'll see you on the next one. Cheers.